Okay, well, we are going to, it's a few minutes early. We're going to just move right into our next panel. We have someone joining on the phone, so we will see if we can get that person on. But I think this panel was, we had a little times that seemed to get us into this situation. Well, how about if the next panel comes up and John Auerbach, I'll just turn it over to you to moderate the discussion on return on investment.
Thank you very much. Well, good afternoon, everyone. I think this should be a lively discussion because I think we've already begun to hear a lot about the issue of return on investment. We started the day with hearing Admiral Giroir asked the question of how do we create the business case when the benefits of investing may be far removed from the impact on health or on the financial return. So that was a specific question he really wanted us to weigh in on. And then over the course of the day, we've heard other people begin to raise what are some of the challenges that you face when you're trying to answer those questions. We heard Seth talking about the difficulty in measurement. Are we looking at patient-reported outcomes or quality metrics? We also heard people in the last panel talking about the wrong pocket notion where you might there might be an intervention that costs a particular sector something, but that the benefit goes to another sector, and that therefore squaring that can be complicated. And then we also heard about the temporal differences, that there's pressure to show a result, a return on investment in a limited amount of time when we know that it may take several years or a generation even. These are important but also complicated issues. And so we're very fortunate to have with us three people, and maybe a fourth that will join us electronically, who are very knowledgeable about different aspects of the questions associated with return on investment. I'm going to introduce each of them, including the person who may join us electronically, and I'll do it in a particular order, but we may need to be flexible about the order given the guest who's joining us. The first person to my left is George Miller. Dr. Miller is an Alterum Institute Fellow, and he works at the Alterum Center for Value in Healthcare. And over the course of a distinguished career, he's worked on the issue of trying to quantify the value of investments in primary prevention that is non-clinical for different populations and stakeholders. And he's currently involved in co-directing an RWJF funded effort to look at the estimation of economic costs in childhood-led exposure, for example. Our second panelist is Dawn Alley. And Dr. Alley is the Director of Prevention and Population Health Group at the Centers for Medicare and Medicaid Innovation, or CMMI. And she is responsible for innovative payment and service delivery models, including the Accountable Health Communities model, which we've talked about a good deal already today, as well as the Million Hearts Cardiovascular Risk Reduction model and the Medicare Diabetes Prevention Program. The third panelist who is here with us today is Catherine Hobbs-Knudsen, and Dr. Knudsen is the Chief of Behavioral Health at the Blue Cross Blue Shield of North Carolina organization, and she is an adult and child psychiatrist and an adjunct assistant professor at the Duke University School of Medicine, and she's involved in leading the strategy for value transformation for behavioral health and focusing on alternative payment methods and outcome measurements. And then the fourth panelist, who we hope will be joining us electronically, is Julian Harris. Dr. Harris is the president of Care Allies, which is an innovative population health management services company that's focused on helping physician groups and delivery systems navigate the transition to value-based contracting. And Dr. Harris has worked at Centrum He's worked at the Office of Management and Budget on health issues, and he was the Massachusetts Medicaid director. He's off-site, and so we're not sure whether that connection will be made. And when he joins us, we may transition specifically directly to him in order not to lose him. But we're going to start with Dr. Miller.